Welcome to Bloom. In this video, you'll learn useful information about genetic testing for pharmacogenetics. Pharmacogenomics is the study of how genetic differences among individuals cause varied response to a particular drug. These genetic differences are used to predict whether a medication will be effective for a particular person and to help prevent adverse drug reactions. Many drugs that are currently available are one-size-fits-all, but they don't work the same way for everyone. It can be difficult to predict who will benefit from a medication, who will not respond at all, and who will experience negative or adverse side effects. Are your prescription drugs working for you? What traditionally works for one person may not necessarily work for another, and more frequently that has become the case. This test provides you and your prescriber the insight needed to know if your current medications or dosages are the right fit for you, while minimizing or eliminating undesirable side effects. Have you ever asked yourself, does this medicine work for me? Just as gene variation controls hair and color, your genetic makeup also controls how your body reacts to certain medications, both prescription and over-the-counter drugs, as well as herbal remedies. The Bloom pharmacogenetics test will determine whether the medications you are currently taking are safe and effective for you. Results from your pharmacogenomics test will provide specific information of how quickly your body metabolizes or filters a given drug. Some people are rapid metabolizers. They flush drugs quickly from their system and may not realize any benefit from taking a normal or one-size-fits-all dose. A person who is a poor metabolizer is just the opposite. In a person who is a poor metabolizer, a normal dose of medication can build up to potentially dangerous levels. Understanding how you metabolize the medications that you are prescribed allows you and your doctor to customize your treatment and determine the safest, most effective dose for you. The Bloom process begins with a medical assessment done over the phone to first determine the types of medications you are currently taking. The completed assessment is completed at the oversight of a certified licensed pathologist, and if, in their professional opinion, there is a risk, the pathologist will send the medical assessment to your primary care physician, along with a request to authorize the Bloom pharmacogenetics test. The Bloom test must be ordered by your primary care physician. A specimen kit consisting of a simple cheek swab is then shipped priority express mail directly to your home at no cost to you. Once it arrives, a counselor will call and walk you through the process, and you will simply mail the specimen kit back to the lab. Once the laboratory performs the genetic test, those results are sent to your primary care physician. We believe it's important for you to understand what can and cannot be learned from a pharmacogenetics test. Personalized medicine is the tailoring of medical treatment to the individual characteristics of each patient. This approach relies on scientific breakthroughs and our understanding of how a person's unique molecular and genetic profile makes them susceptible to certain diseases. Advances in personalized medicine is having an exciting impact on patient care, as it has provided your physician with tools to predict which medicines will be safe and effective for you and which ones will not. Personalized medicine is an extension of traditional approaches to understanding and treating disease. The Bloom pharmacogenetics test equips your physician with a more precise tool for selecting a therapy or treatment protocol based on your molecular profile that may not only minimize harmful side effects and ensure a more successful outcome, but can also help contain costs compared with a trial-and-error approach to disease treatment. Regardless of the type of results you receive, they will be shared with your healthcare provider. This can help you and your provider create a personalized medication and treatment plan that is specific for you. You can learn more about the Bloom pharmacogenetics test by visiting our website at www.mybloom.life.